So as you're listening to this show, or as you're watching this YouTube video, depending upon how you're doing it, we are just moments away or days away from the healthcare exchange open enrollment period from beginning. Now, let's explain. So we've heard a lot of demagoguery from Republicans about how this is not going to work and why this is socialized medicine and blah, 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 blah. But let me here on the Fowler Show tell you why it is important that you get enrolled in the healthcare exchange. First, let me start out by talking to you about what the health insurance marketplace is. The marketplace is a new way to find quality healthcare coverage. It can help if you don't have coverage now, or if you do, but you want to look at other options. With one marketplace application, you can learn how to get lower rates, lower cost. You can change your healthcare coverage. You can swap and shift things and make it work for you. If you're a younger person, you might want to get catastrophic care, which limits like ridiculous healthcare costs. If you're an older person, you might want to get more benefits. It basically gives you the opportunity to go into a marketplace, a free marketplace, and get the healthcare that you think is best for you and your family. The marketplace can also tell you, once you enroll in the marketplace, it can also tell you whether or not you qualify, or you and your family qualify for Medicare or Children's Healthcare Program, also known as CHIP. Now, everyone is eligible to join the marketplace. Everybody's eligible to join the exchange. Most Americans will be eligible to use the marketplace. Now, with this being said, we've heard a lot of arguments from Republicans that say if your current healthcare employer, if you have your current healthcare will change. That's not true. If you are currently under employee covered healthcare, for example, if you are under a Blue Cross Blue Shield plan with your current employer, you keep that healthcare. Your healthcare does not change, nothing changes unless the company decides that they want to put you in a marketplace. And in that case, a lot of companies like Walgreens, for example, are issuing subsidies of the same amount they would have given you to pay for your healthcare to allow you to go into the exchange. Now, I guess the next question you're asking yourself, and I know this is the policy breakdown, so usually we're talking about policy, but I'm literally breaking down to you how this works. So I guess the next question you're asking yourself is, how, Richard? Tell me how I get involved, or how do I get enrolled in the healthcare exchange? Well, here is how you get involved in the healthcare exchange, or how you enroll, right? Because you want to find out how you get in, how you enroll, how you become part of the exchange. And this is how you do it. First, you go to healthcare.gov. When you go to healthcare.gov, they will give you all the information that you need. And they'll ask you to fill out a form. It'll tell you the next steps. It's a very, very simple process. Look, I am on healthcare.gov on my computer right now. Healthcare.gov. Go to the website, check it out, join the exchange, right? And we could walk you through this. I mean, it's so simple, guys, here on Fowler Show. Now, for those of you who are listening on our show, go to healthcare.gov. They even have a YouTube video there that explains it to you, right? And you can start enrolling as of October 1st, meaning you can go in and enroll in just a couple days. Now, here's why it's important, why you get enrolled in the healthcare exchange. Now, let's talk to young Americans, right? So if you're a young American, you're covered under your parents' health care insurance until the age of 26, right? But the good news here is that in the exchange marketplace, they must cover your contraceptions for all women, and counseling for all women. And, no one, we all know out there, no one plans to get sick. No one plans to go to the doctor. Hell, no one plans to go to the emergency room. The key word behind that is emergency. You don't plan to have an emergency. Nobody wants to have an emergency. And nobody wants to deal with the high cost of healthcare once they have those emergencies. But what the Affordable Care Act allows you to do, it allows you to go in and buy a policy, and the government, for the first couple of years, will subsidize, based on your income, will subsidize how much you actually pay. They'll give you a tax incentive to join the exchange. So I say to you all out there tonight, whether you're young and listening to this show, or whether you're middle-aged listening to this show, whether you're old and listening to this show, or you are one of our, what I would call, what's the right word I'm looking for here, our living legends. If you do not have healthcare coverage, I need you to do me this favor. Join the healthcare exchange. Get the coverage that you need. It's easy to do, folks. Just go to healthcare.gov. And I'm not telling you, I am no messenger from the president. You've seen me on this Fowler show go against the president, go with the White House, and go against the White House. This one is not about the White House. This is not about politics. This is about your well-being. I want to make sure that Fowler Nation is the healthiest nation that exists on earth. And the only way that can happen is if you get involved and get the health care that you need, especially if you are uninsured. I'm talking to you if you are uninsured. Don't believe the hype. There's a lot of people out there, a lot of Republicans telling you not to enroll. Don't get involved. Socialized medicine. They're death panels. That is just not true. This is the same private health care that you would get if you're unemployed and you're currently looking for health care. It's the same health care you get. A lot of the major healthcare companies, you could buy their coverage in the exchange. Meaning you're not going to get some rinky-dink, Joe Schmo, I'm selling healthcare out of my trunk type of healthcare. You're going to get real healthcare from a real healthcare provider. On top of that, we are going to get more preventative care because the Affordable Care Act had provisions that allow you to get mammogram screenings and pap smear screenings and prostate screenings as part of your health coverage. So basically not really free of charge, but you could say free of charge, but the truth of the matter is it's wrapped into your coverage. So you're not paying additional amounts for that. You need the healthcare exchange to access those benefits. Now, let me go a step further. Because many of you out there own small businesses. And you're like, oh, the healthcare exchange is going to destroy my small business and blah, 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 blah. Now, I want to tell you that you can get help, and there's people out there that will answer all of your questions about how your small business can opt into the Business Health Options Plan, a new way to buy high-quality health insurance for your employees. That also starts on October 1st, 2013. And you can go to the website and read about it, or you can just call them, 1-800-706-7893. And they will answer all of your questions. They're available Monday through Friday, 9 to 5 Eastern Time. Listen, guys, they have made the Department of Health and Human Services has made this as easy as possible for you to be part of the exchange. Easy as possible for you to get help. This is the first time in American history where the American people have found that this is the easiest way to get health care. Health care has been such a struggle for so long. People lost their homes. People lost their cars. People lost their jobs because of healthcare coverage. America, don't get me wrong, Obamacare doesn't go far enough. We need a single payer option. But this is a step in the right direction. So I need you to do me a favor. Go to healthcare.gov, learn up about the exchange, and get enrolled. It's just not good enough for you to wait anymore. It's not. When you have children in Maryland dying because they can't see a dentist, and you have people who can't see the board in college and in elementary school, and people think they have a mental disability, it's really because they don't have glasses to see the board. We have a healthcare problem in this country. We have a healthcare crisis, and the healthcare exchange and the Affordable Care Act is a step in the right direction to fix that crisis. But it can only fix that crisis if we all do our part. Gotta do our part. What makes America so great is the American people. And the American people always stand together. And when it comes to making sure that we are a safer, healthier nation, we need to stand together once more. Join the exchange. Healthcare.gov. We'll be right back on the Fowler Show after this break. Don't you go anywhere.